you folks seeing just the PowerPoint and not me?
And Elsa, and please help me along. This is my first virtual presentation, and I'm very excited to be on the call with everyone. But my background is I've been doing presentations for the last 12 years, of course, in person. My name is Taryn Kumamoto, and I'm with an agency called Premier Benefit Consultants. I'm a Medicare insurance broker consultant. So I represent multiple carriers. That's what a broker is. I represent HMSA, Akamai Advantage, United Healthcare, and Humana. I'm also in the process of getting a license with Aloha Care and WellCare, which is Ohana. So for the past 12 years, I've been only doing Medicare insurance. So I do have a wealth of knowledge I can share with you folks. And before that, I was a financial advisor, just like Kelly and Glenelle. So I think that's why we clicked so well, because we were in the same, I was in the same field. So with that being said, I've always worked with a lot of people nearing retirement. And so we have a lot of information to share with you. Please chat, put your questions in the chat box, and then I'll be happy to go over them with you. The items that we emailed you, so I'll just show it to you here. And I don't know if I can see myself, but here we go. This one, learning the basics of Medicare. These things, we're not going to go into it on the video or on the presentation. It's just for you to keep. It's a lot of great information on here. You can just print it out later. It's about 10 pages or so. Also, this 2020 Medicare cost sheet. This is a really good sheet. So break down the cost for you. And also this quick look at Medicare. Okay. So if for some reason you didn't receive these PDFs, then please let Kelly and Glenelle know. Okay. And let's get started. So welcome everyone. Thank you again for coming. I'm going to be talking about Medicare Made Easy, and I'm going to give you all the information what you need to know, probably even more about Medicare. So let's get started. Agenda. So Medicare Basics. So what is Medicare? When are you eligible? When can you enroll? And what is Medicare Part A, B, D? What is a Medicare Supplement Plan, also known as a Medigap? A Medicare Part C Advantage Plan, and how to choose a plan. So you see on your on the screen, it has the red, white, and blue card. That's your Medicare card. So Medicare, A is hospital, B is medical. And, oh, I mean, you folks can see I'm sorry, my assistant is helping me through. So you folks can see this presentation, right? It says Medicare with the card, yes. Right?
Yes.
Yeah, okay, so that's fine. Okay, so if by any reason you still have your Medicare card with your Social Security number on it, that card is old. So if you did not receive a new card with a unique member number, which has numbers and letters, make sure you call Social Security and ask them, you know, I didn't get a new card. Someone told me that I was supposed to get a new card. All the new cards were mailed out by April 2019. On top of that, if you have the new card and your old card, just make sure that your hospital A and B dates are the same, because I did come across a client and she had different numbers for her effective date. So you definitely want to call Social Security and find out what happened. So that's your Medicare card. And let's talk about the basics. So Medicare is a federal health insurance program. The federal government funds Medicare through your payroll tax contributions, known as FICA, F-I-C-A, FICA. And it's about 7% that's taken out of your paycheck. So you pay a percentage and then the employer pays a percentage, and that goes to pay for Medicare Part A. And again, Part A is hospital. So Part A is premium free, meaning you don't have to pay a premium because you were paying your FICA taxes, or if your spouse was not working, then you were paying into that system, but your spouse can receive Medicare Part A premium free. qualifying for Medicare, you must be a U.S. citizen or a legal resident who has lived in the United States for at least 5 consecutive years. You or your spouse worked 10 years or 40 quarters in the United States and are age 65 years or older. People under age 65 that collect Social Security supplemental disability can qualify for Medicare as long as they've had the disability for 24 months or longer. And so again, that you would have to work with your doctor. If your doctor sends the information to Social Security, and then they'll start the process for your Medicare card. For example, I have clients that are 20 years old, 30 years old, 40 years old, and they have Medicare because they have a disability. And anyone with ALS or Lou Gehrig's disease or kidney failure, which is we call ESRD, end-stage renal failure, they are entitled to Medicare as well. Enrolling into Medicare. So we have a couple of different periods. One is called initial enrollment period, which is a 7-month period. So for you folks who are younger than 65 and you're preparing, so you have a 7-month period, meaning it starts 3 months before your birth month, then your birth month is the 4th month, and then 3 months after you turn 65. So we call that initial enrollment period. You want to sign up on your own if you are not collecting Social Security. So again, if you're 62, 63, 64 years old, you're not collecting Social Security, and next year you're going to be 65, you have to initiate the signing up for Medicare. It's only people who have or are receiving Social Security benefits, then they will receive the Medicare card automatically, okay? And then I know you folks may have some questions like, oh, well, Taryn, I'm still gonna work when I turn 65, you know, what do I do? Do I still sign up for Medicare? And the answer is yes. You wanna be sure you sign up for Medicare A, at least Part A, if you're still working. And if your employer is still covering you for medical, then you can delay Part B. So just sign up for Medicare Part A 3 months before your birth month, if possible. And then it will be effective your birth month.
Yeah, and we have a question. It might be premature to let you know what age can my spouse go under my plan?
Oh, that's a very good question, because remember, Medicare is an individual plan. So everyone has to get their own Medicare insurance. So if you're 64, going to be 65, and your spouse is younger than you, then you need to discuss that and say, you know, you're still working, because your spouse, if they're younger than you, they have to wait till they hit 65. So just remember, every person has to be Medicare eligible, which is most times turning age 65, and you'll have your own Medicare insurance. Again, if they didn't work, they would qualify under your benefits, but every person has to have their own Medicare insurance card. Okay.
Thank you.
Thank you for the question. Yes, please chat away. So if you are turning 65 in a few months, it will be effective the 1st of your birth month. So if December, your birthday is coming up, you can apply now, but even though you're applying now, it's not effective till December 1st, okay? And even after, let's say it's January and your birthday was December, don't fret, you can still apply. It's just that your Medicare Part A or A and B may be effective the 1st of the following month, so that's fine, okay? Special enrollment period, and I want to be sure I'm looking at the time. Special enrollment periods, so this could be a time when you are still covered by your employer plan for medical. And when you're ready to retire or lose medical coverage, that's when you can enroll into Medicare Part B. So let's say you're 65, 66, 67. You can enroll into Part B anytime while you're still employed. Let's say you employed and you lost medical coverage, and then a month later, you're like, I think Taryn told me I had to do something. Well, you have an 8-month period to pick up Medicare B without penalty. but make sure you do that within 8 months. And as a matter of fact, you probably will not, that won't happen to you because you may not have medical coverage, right, after you retire. So we want to help you transition seamlessly from losing your employer coverage and then picking up Medicare B right after, and then Medicare D, D is in drugs, right after too. So on your notes somewhere, you want to make sure for Medicare D and B, just write down late enrollment penalties. And you can remind me about that. I can talk to you later when that comes about. But there's late enrollment penalties if you don't sign up for Medicare B and D when you're supposed to. And then your general enrollment period, so that's January 1st to March 31st. So if some people missed it, and unfortunately some people do, you can sign up for Medicare A and or B during this time, and then it'll be effective July 1st. But again, you might have those late enrollment penalties. And those penalties are for life, unfortunately. Okay, let's move on. So original Medicare.
We have a question,
So
Taryn.
Sure, yes.
Can you still have your employer coverage and Medicare after you retire?
After you retire. Well, I guess we have to double check your employer coverage. Is it a retiree coverage? If it's a retiree coverage, then yes, right? If you're state, city, we probably forgot to ask if there's anybody here on the state, city, or federal retiree. But yes, you can have that and Medicare after you retire. But usually if you don't have a retiree medical plan, then you would have original Medicare and then either a supplement or an advantage plan.
Okay, thank you.
So original Medicare, is that any more questions for now?
That's all for now.
Okay, cool. So original Medicare is $144.60 a month. That's per person. Remember, Medicare is per person, and it covers your doctor visits, your medical equipment, other medical and preventive services. So typically, you pay 20%, and the government pays 80%. So that's Medicare. It's the 80-20 coinsurance. If you have a higher income, then you may pay more for Medicare B and D premiums. That's called IRMA, Income Related Monthly Adjustment Amount. So on your 2020, this one here, this 2020 Medicare cost, and on the bottom it says, I'm sure you have there's a better way to do this, but on the bottom it says modified adjusted gross income. So Medicare and the IRS is going to look at your 2 years prior tax return for your Part B premium. So if someone's going to retire this year, then you're going to look at 2018's tax return, and then you're going to look to the far right, and it's going to say $144.60 a month. Okay, but you have this, and then so that's how when we talk one-on-one, you'll see the different premiums. Okay. So what's not covered by Medicare? So Medicare does not cover routine eye exams, eyewear, dental, hearing exams, hearing aids, long-term care, and prescription drugs. So how are ways to complete your Medicare coverage? So again, for those of you folks that are city, state, federal, or have a union plan, you would most likely, you're just going to keep that plan in retirement, and then you're just going to pick up Medicare A or A and B. And for anyone else, you're only going to have original Medicare, so you definitely want to pick up an additional plan called a Medigap or Medicare Supplement, and a Part D drug plan, or a Medicare Part C Advantage plan. Okay, so in that one, here, your quick look at Medicare, and that gives you the same thing I'm talking about. It's either original Medicare with the supplement and the drug coverage, or on the right side, the Advantage plan. Okay, so it's either or, you can't have both. That's the government's rule.
We have
And so it looks like this. Yeah, yeah, sure.
First question is, what if I retire early and have little income because I'm living off my savings account? How is the premium calculated?
Okay, good question. So if you retire early and I'm sorry, we probably need to chat more, but if you are under 65, then you would either, number one, buy COBRA through your employer, and that can be expensive. Number two, again, this is for people under 65 and you're retiring. Number two, if your company offers you extended medical, I know some unions, not maybe unions, but some plans do offer that. You can buy it. Number three, you could try to qualify for Quest. So Quest is a state and federal program. So you may qualify based on disability or limited income and limited assets. Okay. If you're, so that would be some of the ways to pay for medical coverage if you're not yet 65. And then of course, if you're 65, then we go on to Medicare, right? And then that would be $144.60 a month. But also too, if you do qualify for Medicaid, even when you're Medicare eligible, we call that dual eligible. So we have some Medicare plans that are no charge, a zero premium Medicare plan, and you know your Part B, the $144.60 you're paying for, if you qualify for Medicaid, then the state will pay your Medicare Part B premium. Okay.
Okay,
so,
one more question.
Yeah.
This one you might need to
Sure.
help privately, but husband 62, wife is 65.
Yeah.
Wife does not qualify. She doesn't have the credits. When does she get to go on husband's plan?
Okay, that's a good question. So I believe she's 65. I believe she might have to wait till he is 65 because he's Medicare eligible, but I would definitely contact Social Security. So contact Social Security at 1-800-772-1213. That's the national line. You can also Google the Honolulu or Kapolei office and ask them. That's a good question. I'm sorry I don't have the answer for you. I'm thinking they may have to wait till the spouse turns 65 because he's the one that had he's the one contributing to the Medicare plan. Thank you.
Thanks.
Great. So this is what it looks like on your Medicare A and B. And again, either we go on the Part D with a supplement route on the left-hand side, or your Medicare Advantage plan called Part C. So the Medicare supplement, so these are offered by private insurance companies. They're also known as Medigap. It helps to pay for some or all of the out-of-pocket costs that come with original Medicare. It's a supplement to Medicare A and B only. So there's drugs is not included. So Medicare D is not included. And it usually doesn't include extra benefits like free gym membership or chiropractor and acupuncture, which you may find on a Medicare Part C Advantage plan. So what I like about the supplement is you're going to keep original Medicare, your red, white, and blue card, and then this supplement is just another card, and it'll supplement your hospital and medical benefits. The premiums are based on age, so you can chat with me after, or you have my information, and you can call me or email me, and then we can talk about cost based on your age. And there's 10 plans. The plans, I know it kind of gets people confused because it also starts with Plan A, Plan B, Plan C, D, F, G, K, L, M, and N. So remember, supplements are called plans, but your Medicare is parts. You have Medicare Part A, Part B, Part C, and Part D. But when you're talking about a supplement plan, it's called plans, Plan A, B, C. And each letter corresponds with different levels of coverage. And the supplement plans are underwritten by the insurance carrier, and the premiums most times increase about 5 to 8% every year. Okay. Now let's look on the other side. So we stated the Part D and the supplement plan, okay, because now we're going to look at Medicare Advantage Part C. C as in cat. So the Part C Advantage plans were created in 1997 with the plan sales starting in 2006. It's offered through private insurance companies. So it pays instead of original Medicare, meaning when you have your red, white, and blue card, and then you have your Medicare Advantage card, you will not show the two cards to your doctors and pharmacy. You're only going to show that one Medicare Advantage card because now you're in a managed plan. So all of the benefits of original Medicare are inside your Advantage plan card. Okay, so please remember that. That's very important. You may go to the doctor and they may ask you, oh, show me your red, white, and blue card as well as your Advantage plan. That's fine, but they should know they're really only billing the Advantage plan card, the Part C card, okay? Whereas your Medicare supplement side, you do have to show 3 cards: original Medicare, your supplemental card, and your Medicare Part D card, okay? So if you go the route on the left, you're gonna show 3 cards. The route on the right, which is the Part C, you're only going to show your 1 Medicare Advantage card, okay? And the benefit is it includes extra benefits. It could include dental, so not all of them do. Vision, hearing, emergency outside of the United States. And some of them, or most of them, do include a Part D prescription drug plan. So we like to call it a bundled plan. So Part C, bundled, meaning Medicare A, B, and D are inside your C plan. And please remember that you always have to pay your Medicare Part D premium. So remember this here. And then I showed you the cost, the $144.60 and this side, $144.60 and going down. So you always have to pay your Medicare Part D plan premium in addition to your Advantage plan, okay?
Since we're on
unless you have Medicaid.
On the topic of cost, somebody asked if these costs are paid monthly, always.
Yeah, so thank you for that question. The costs are paid monthly, and when you have, when you are receiving Social Security benefits, it automatically comes out of your Social Security benefits. But if you're not collecting Social Security, and again, that's monthly, if you're not collecting Social Security benefits, then you are billed quarterly. So if you are in that bracket of $144.60 a month times 3, that's $433.80 a quarter, you're going to get that bill. So don't be alarmed. I get phone calls and they say, Taryn, what is this $433.80 bill? I said, that's your Medicare Part D premium because you're not collecting Social Security yet. So they're going to give you a quarterly bill. You can, however, sign up with Social Security. They have an online form and I can send that to you too. But it's an EFT, so you can deduct it from your checking account if you are not yet collecting Social Security benefits and you don't want to write a check every quarter. You can have that deducted from your checking. In addition, you can, when you get that bill, you can pay via credit card too. So that's nice. You can rack up the miles.
Wow. Another question.
Don't worry, they know how to get your money.
Another question is, so A and B, just to clarify, does not cover dental?
Correct, yeah. So I'm so sorry, I don't have my Medicare and You book handbook, but it's the dental is not covered under original Medicare. Oh yeah. That's why we have an assistant. Yay! So here, your Medicare and You 2020. If you have this book, this is your go-to book. This has a lot of information in here, and it'll tell you what's not covered. So dental and hearing is not covered. Okay, so Part A is just your hospital, B is medical, and D is drugs. So thank you for that. Yes. Okay.
Stay with him
So
because
going
he's
on with
his phone.
more questions.
You're going to mute the rest of the people, if possible.
Oh, I may have to mute.
We got some callers on and to be muted. Oh, I think you did it.
Everyone's
You're good.
muted. Okay, thank you. So more about Medicare. So remember, you have to pay your Medicare Part B premiums. You have to have Medicare A and B to enroll in the Part C plan. So I think that's where people get confused, right? They say, oh, I have Medicare A, I'm still working. I've heard about this Medicare Part C Advantage plan. I want to get that plan, but you have to have both Medicare A and B to get Part C, okay? And you only show your Medicare Part C Advantage card. We already talked about that. The benefit of a Part C Advantage plan is you have something called the annual maximum out of pocket. So again, this is not a deductible. This is just saying, I'll just use for an example, $3,400 maximum out of pocket. If you, the medical plans are covering you from day one, but you have co-pays, right? You have co-pays for doctors, you have co-pays for hospital, you have co-pays for your labs, but the back end, the insurance company is paying the balance. So now once you paid for this annual maximum out of pocket, let's say $3,400 all by yourself, then the insurance company will pay the balance. So let's say you've hit that $3,400 maximum out of pocket. Then the insurance company that you're with, the next time you go to the hospital, you don't pay anything. They pay that. Okay, so that's called a maximum out of pocket. On your original Medicare card, they don't have an annual maximum out of pocket. That's why you want to get an Advantage plan or a supplement plan. So again, original Medicare doesn't have that annual maximum out of pocket. Again, with Part C Advantage plans, you want to use network providers. So the network providers will provide you a lower copay versus using out-of-network providers. When we talk, I'll ask you for your doctor's names and a list of your medicines so I can help you check that they're in the network. You may qualify for financial assistance. So again, if you meet the requirements for MedQuest, we call, which is Medicaid, then you may get assistance to help paying for your Medicare Part B premium. If you enroll in Medicare Part D, which is drugs, late, again, you may have late enrollment penalties, which we talked about. And maybe I'll just tell it to you here. So write down in your notes, Medicare Part D, the penalty, it's 1% times the number of months you didn't have a Part D plan times an average Part D premium of $35. So again, the calculation is 1% times the number of months you didn't have it times $35. And then a Part B, we'll write down the Part B penalty too. B as in boy. So write it's 10% penalty times the number of a 12-month period. So in other words, if you didn't have Medicare Part B when you were supposed to for 1 year, so that's 10%. But let's say you didn't have Medicare Part B for 2 years, that's 20%. So the $144.60 Part B premium, if you didn't have that for 1 year, you're going to add on another $14.46 a month to your $144.60. That's how you calculate the penalty. And again, that penalty is for life, however long you're living and you're on Medicare. Okay. Lastly, Medicare Supplement Plan is not a Medicare Advantage. So if there's one takeaway today, just remember, oh, Taryn kept telling me about a supplement is not an Advantage plan, and an Advantage plan is not a supplement. You are correct. So they're two totally different products, as you folks have already learned today.
We have a question.
Sure.
How does this affect military retirement TRICARE?
Oh, great. Yes. So I do have a lot of members that are TRICARE for life. They transition from TRICARE or VA. So we definitely could add on a Part C Advantage plan, even the supplement plan, depending on how much coverage you would like. But we do want to ask and make sure that, let's check if you use civilian doctors, you know, we want to take their names down and check if they're in the network. And then also the prescription drugs. So where do you get your prescription drugs at? Do you go to Tripler and pick up your medicines? Do you only want to go there, or do you also want to be able to pick it up at a local pharmacy? So that's why we do have some Medicare Part C Advantage plans that have drug coverage or some that do not. Some people say, hey, I only want to pick up my prescription drugs at the military And so I don't want any other drug coverage plan, but I want a Part C because I see extra benefits. We can put that on for you. So we want to talk to you one-on-one, gather some more information. And yes, you definitely can put those on because as I mentioned, some Part C plans are 0 premium. So it doesn't hurt to put it on. And I've had clients who's been with me since 2000, how long have I been doing this? 2008. Sorry, I probably forgot to share with you that I've been doing this for 12 years, did I? But 2008, I've been helping people with Medicare, and so they've been on these Part C plans with me ever since. So some things to consider back in the slide, we're gonna look at PPOs versus HMOs, and you can choose, but most plans we have PPOs, so that just means you can see doctors in network and out of network. If they're in network, you pay a lower copay. Out of network, you pay a higher copay. So again, access to care, do your doctors participate? That's where I'll help you look in the booklet. Coverage while away from home. You know, are you traveling? We'll look at the other states and make sure you're covered. What are the drug formulary and drug tiers? What if I have state, city, or federal, which we talked about, and VA or TRICARE coverage? So you can call me up or email me, and I humbly ask you to do both. Right now is open enrollment period coming up in a couple weeks, so it's a very busy time, and I want to be sure I take care of you and answer your questions. So I do ask if you could email and leave me a message, or email and text, so I can get back to you promptly.
We have a question. Is
Yes.
there a national PPO?
A national PPO? Could they clarify or chat a little bit more?
Yeah, I'm not sure I understand.
I'm thinking.
I'll see if he says anything else.
Okay, I'm thinking when you join a Medicare Part C, and thank you for your question, a Medicare Part C Advantage plan, you have to sign up within the state that you live in. So if you live in Hawaii and your address with Social Security is Hawaii, then you need to sign up for a Part C plan in that state. If you're moving to another state and you go to Vegas, then you need to change your address with Social Security, and then you'd have to pick up a Medicare Part C Advantage plan in that state. You may also be talking about a Medicare supplement plan. So a Medicare supplement, also known as a Medigap, that one you can purchase and you can just take it with you. So meaning you're going to have original Medicare, your Medigap, and a Part D plan, but you don't have to change your supplement plan. You can just keep that with you because your primary is original Medicare. So maybe that's what they were asking. That could kind of be like a national PPO, but it would be called a Medicare supplement.
Okay, he said he'll talk to you offline. Thank you.
So thank you. The marketplace coverage. So I'll just briefly go over this. This is for people under age 65. So if your friends or family are self-employed and they're not yet Medicare eligible, they might have a marketplace coverage, and that's fine. It's just for them, the premiums are pretty expensive. So when they turn 65, they're so happy to meet me because they're like, oh my gosh, Taryn, you're saving me like $800. So I said, okay, great, take me out to dinner. No, just kidding. But they do save a lot of money because they might be paying maybe $800 or $1,000 a month just for them, for an individual plan. So when they turn Medicare, as you folks know, it's $144.60 a month for Part B. It could be higher if your income is higher, and then they'll pick up another Medicare supplement or Advantage plan for a premium. Okay. So completing your Medicare, this is what the chart looks like. So again, you have your original Medicare card at the top. And remember, you're going to choose one of two routes. You're either going to go a Part D drug plan with a supplement or a Medicare Part C Advantage plan. So remember, you can't choose both. It's either or. However, you can switch year to year. And if you want to write down October 15th to December 7th is the annual enrollment period. That's the time, if you're already in a Medicare plan, you can make a switch. And then it's effective January 1st of the following year. So there's times throughout the year that you can switch. You're not totally locked in forever, so don't be scared. And then you can also write this down, January 1st to March 31st is another open enrollment period. So January 1 to March 31, and you can make a one-time switch. So if you're in a Part C Advantage plan and you want to switch to another Part C Advantage plan, you can, but you can only do one time. Versus during October, November, December, if you switched one time, two times, three times, that's totally fine. It's the last plan you signed up with will stick, and that will become effective January 1st. Did I see questions? Did I see some chat? Yes.
No questions.
Oh, no. Okay. I'm sorry. Great. Awesome. Okay. Oh, and then I'm sorry. So then let's chat. So let's chat. I'll leave my information up, and I'm right on time because there's a lot of more information I could share with you folks, but we can open up to chat. And if you have the time, stay on. And if not, then please email me, call me. You'll see our webpage. You can also reach me through Glenelle and Kelly. And by the way, before you folks head off, you know, I didn't talk too much about the part A and B. So just to give you a heads up, because Glenelle and Kelly are advisors, and when I sit down and I listen to their presentations, you know, they're trying to help you mitigate the cost for your health insurance, right? So you may want to talk to them about the long-term care insurance, because long-term care insurance or long-term care health benefits is not covered under Medicare. Okay, so Medicare does not cover long-term care insurance. It's only skilled nursing, which is short-term intermediate care, meaning you're going to get better. And so you may want to talk to them about that. And I know other vehicles through your financial person, they may have things with annuities or life insurance with a long-term care rider. So you may want to talk to them about that, because I know people always are misinformed and they think that you're going to get long-term care insurance with Medicare, and that's not true. It could be if you're Medicaid. If you're Medicaid, then you may qualify, of course, for the care home, but that's because you have a limited income and limited assets.
Yeah, thank you for saying that. And actually that is a perfect lead in for the next webinar, which is October 20th. And that's a Tuesday, 11:30 to 12:15 is our next webinar. And that's where we'll be talking about long-term care, what it is, what it means to receive long-term care, and then different ways to pay for it. So thanks for that, Taryn.
Sure.
And to get a list of our webinars, you can always visit our website, summitfinancialhawaii.com. And then on the top bar, you can go to workshops, click on that, and that gives you a list of our workshops, and then you can register and it'll send you a Zoom link for that. Let's see, thank you. We got a thank you from Joy. Thank you so much.
You're welcome. Thank you.
So far, no
Any other?
But that was, here we have one. For part C, do you see any differences on the plans, Humana versus HMA, that you can comment on? Does one provide better service? Thank you, very informative.
Oh, okay, great question. So definitely email me and your information too, because I'll be doing presentations on those specific plans after October 1st. So the 2021 benefits will come out October 1st, and then I'll also do presentations because I'm a broker and I represent HMSA, United Healthcare, and Humana. I'll do some HMSA presentations and United Healthcare presentations. I can talk about all three carriers. So in a nutshell, but I can't talk to them. I can't say the details here because it's an educational presentation and there's a lot of rules under CMS and Medicare. But in general, they're relatively the same. You'd need to look at each booklet side by side and compare. But the main two things you want to do when looking at your Part C Advantage plans and comparing them is, number one, you want to make sure that your doctors are in the network. Okay, so get the list, or you can go online or ask the agent, can you check for me that my doctors are in the network? And then number two is making sure that your prescription drugs are in the network. Okay, so your medicines, give the agent your list. If you're computer savvy, you can go on each of the insurance companies' websites and put in your medicines yourself, and it'll pop up and it'll tell you what tiers there are and what it would cost you. So again, make sure the doctors are in the network, the prescription drugs are covered, and then you're going to look at the premiums, right? If there's a premium or no premium, and then also what is the maximum out of pocket? So it could be $3,000, it could be $6,000. And then you want to look at the extra benefits that could give you more services. So thank you for your question.
Thank you. We have another question. My mother, this is a hard one. My mother-in-law will be living with us in the future when my wife is a U.S. citizen. Can my mother-in-law receive help?
Oh, I'm sorry, their mother-in-law, sorry, the audio went out.
My mother-in-law will be living with us in the future when my wife is a U.S. citizen. Can my mother-in-law receive help?
Mother-in-law receive help. Are
Yes.
you talking about help from Medicaid or Medicare?
I'm assuming Medicare.
Maybe if they're still there, they could chat a little bit more. Main thing is your mother-in-law. I'm sorry.
Either one.
Oh yes. So your Medicare, your mother-in-law could apply for Medicaid, and it's just again based on her information that they're going to ask her name and her assets and her income. So if you think she may not have the assets and income, I would definitely apply for Medicaid and see what they say, and make sure I'm sure she's over 65. Make sure she has Medicare Part A and B, and most likely a Part C plan, an Advantage plan, or a supplement. Maybe she's on, or maybe she's on a retiree plan. So again, you don't want to be without any coverage besides the original Medicare. If you only have this Medicare card, you want to be sure you pick up something else because that's not enough coverage.
Okay, thank you. Everybody says they learned a lot. Thank you. And just to close it out, Doug, our other partner, Doug Slagle, he was on the call earlier, but he wasn't on the computer screen. But thank you, Taryn. I think people are checking off right now, but if you want to leave your screen up with your contact info.
Sure. Thank you so much for spending our time with me, and I'm happy to help you folks along the way. Thanks, Gonelle and Kelly and Elsa, for having me on. Then comes the noise. Okay. So that's it. We're good?
We're good. Have a wonderful